Good day to all. I'm Erica Lee, a Year 4 nursing student from Ames University. It is my pleasure to present on innovation about IV drip set. Today, I want to talk about a serious issue that has been affecting nurses and healthcare workers for decades, which is the needle stick injury. Every day, nurses risk their life while caring for patients, yet their safety is often neglected. Needle stick injury exposed them to HIV, hepatitis B, and hepatitis C, yet little action has been taken to innovate and prevent these accidents. Many nurses feel that their voices are unheard, and they are left to deal with the consequences alone. Today, I want to change that. I want to introduce a solution that not only protects nurses, but also helps the environment. Let's talk about the numbers. Over 2 million needle stick injuries occur among healthcare workers every year. Nurses are at the highest risk due to frequent handling of IV lines and needles. Globally, more than 20,000 healthcare workers contract serious blood-borne infection from needle stick injuries. Study shows that many needle stick injuries happen during IV flushing and medication administration, and surveys show 50% of sharp bins contributed from flushing activity. The measures taken yet to be sufficient to make nurses safe. Did you know that millions of needles and syringes are discarded as medical waste every day? Single-use needles and syringes contribute to hospital waste pollution. Plastic medical waste from IV sets adds to landfill and incineration issues. Improper disposal of sharps can contaminate the environment and harm community. The United Nations Sustainable Development Goals (SDGs) emphasize the needs for sustainable healthcare practices. The reality is that needle stick injuries are preventable. It is time to stop ignoring this issue and start implementing real solutions. This is why I'm presenting a new IV drip set called Easy Flush. Easy Flush is a groundbreaking IV set that eliminates the needs of additional needles and syringes when flushing an IV line. For too long, nurses have been forced to use outdated methods that put them at risk. Easy Flush is here to change that. Easy Flush has two rollers, an ordinary mobile roller to regulate the drip, with one additional roller. When the mobile roller is in the standard drip regulating region, it acts as an ordinary regulator. When the mobile roller pushed to the flushing region, it acts as an effective flushing unit. When the two rollers meet, simply just pull it down to flush the IV drip. The roller will milk the fluid downwards without the use of any other disposable items like the needles or syringes. Here is why Easy Flush is a life-saving innovation. No extra needles or syringes needed to eliminate accidental breaks, reduce risk of exposure to infection like HIV and hepatitis. It saves time by making procedure quicker and safer, and it improves the infectious control by preventing cross-contamination. It's time for hospital and healthcare facilities to take real action. If Easy Flush is successfully implemented worldwide, we can save millions of nurses and doctors from life-threatening infections, reduce hospital costs associated with needle stick injury treatment, prevent thousands of unnecessary deaths from HIV and hepatitis, cut down on million tons of medical waste to protect our planet. Easy Flush supports the SDG by reducing medical waste generation and promoting a safer, more sustainable healthcare system. By implementing Easy Flush, we can reduce medical waste. Fewer needles and syringes means less plastic pollution, lower carbon footprint, less production and disposal of medical sharp, enhance hospital sustainability aligning with SDG 3, which is the good health and well-being, and SDG 12, responsible consumption and production, protect both healthcare workers and the environment is a win-win situation for healthcare and sustainability. With Easy Flush, hospitals can improve nurses' safety and environmental responsibility. The Center for Disease Control and Prevention provides comprehensive guidelines to prevent needle stick injuries. The most effective way to prevent needle stick injury is to remove the needs for needle altogether when alternative solution exists. Now, with Easy Flush, directly aligns with this guideline by eliminating the needs for additional needles during IV flushing, removing a major source of needle stick injury. In conclusion, Easy Flush is just a simple innovation answer all the requests and guidelines according to the hierarchy of risk control. The most effective way to reduce needle stick injuries is to eliminate or substitute the hazard, not just rely on PPE and training. Easy Flush follows the highest level of risk control by eliminating extra needles from IV flushing altogether. It eliminates the hazard by removing the needs for additional needles. It substitutes a dangerous process with a safer alternative. It introduced an engineered solution to redesign IV procedure. It shifts the burden away from nurses and onto the system to provide safer equipment. Hospitals must move beyond PPE and training and start focusing on eliminating risk at the source. With Easy Flush, we don't just reduce needle stick injury, we prevent them entirely. This is the change our nurses deserve. Many nurses feel invisible, their safety concerns unheard. Many feel frustrated, knowing that with better equipment, these injuries won't happen. Nurses dedicate their life to save others. Nursing is a noble profession. Risking their life to save others is part of their routine. But it is unacceptable and inhuman to expect them to sacrifice without fully exploring the available tools according to and not following the guidance of CDC and the universal accepted hierarchy of prevention. But who is saving them? Should they have to unnecessarily risk HIV or hepatitis just to do their job? Should they have to live in fear every time they flush an IV line? The truth is, they feel unappreciated and abandoned, as if their safety is an afterthought. I understand that innovating a new medical solution may incur some cost and inconvenience, but what is the cost of a nurse's life? What is the cost of a mother, a father, a friend, a caregiver suffering from an infection that could have been prevented? Nurses shouldn't have to risk their life to save others unnecessarily. They deserve better. According to the features and findings, Easy Flush merits a lot of attention. For the benefits of the nurses, relevant authorities should proactively look into possibility of adopting this. The authority is responsible for conducting any necessary research if there are still questions that prevent the application for the sake of the nurses. Let's make Easy Flush the new standard in IV care because no nurses should ever feel like their life is disposable. Thank you.